Hey, everybody, welcome back into another edition of the DrBicuspid.com podcast. My name is Kevin Henry. Honored to be the editor-in-chief of Dr. Bicuspid, and also honored today to be joined by Dr. Eric Johnson. Dr. Johnson, how are you today?
Fantastic. Pleasure to be here today. Thank
Hey,
you.
glad to have you on, and I'm
Thank
excited
you.
about our talk today.
Me
Before
too.
we dive in, though, I'd love for our audience to just know a little bit more about you.
Well, thanks for having me. I practice in San Clemente. This is about 18. I have purchased 3 practices. I'm escrow for a 4th practice, so I understand the business side of dentistry. I have 10 employees, associates. I have about 2,000 active patients, so I understand the wet-fingered side of dentistry as well. So I come as an experienced clinician, but I also come as an academic. So I just recently finished a second doctorate in leadership, and my focus was on burnout among dentists. And so I have a personal experience with it. Also, in my leadership opportunities, I've had lots of hallway talks with dentists about burnout. And so I come with experience and also a research perspective. So I have a lot to share, and I'm very passionate about it.
Well, I'm glad you're on today and so
Thank
thankful you
you.
took a few minutes out of your schedule. And I also just want to say I'm very also thankful to the California Dental Association for connecting us,
Me
and I'm
too.
looking forward to the conversation. So, Dr. Johnson, I want to read something to you that we just published in Dr. Bicuspid. It was from a survey that we did of dentists around the country. Professional stress levels averaged 3.35, and that's on a scale of 1 to 5,
Fine.
among our respondents, indicating moderate but notable stress across the profession. So, I want just your 30,000 foot view before we dive in. Are we seeing more stress or burnout now than maybe we have in months or years past?
I think we're becoming more aware of it. And as we become more aware, we're having more opportunities, Kevin, to talk about it. Our current president, Brett Kessler, says it well. He says it's okay not to be okay. And so that's one of his initiatives, is to allow providers to be able to say, you know what, this is a stressful chronic job that I'm in and I need some help. And so I think we're becoming more aware, but we also need to lay out resources. And I'd like to share a little bit about that. I've recently spoke at a convention. There was 180 classes, Kevin. 4% of those classes addressed leadership, burnout, wellness. All the other classes were on the widgets, on how to place implants, which material grafting, which endo supply. There's a huge convention in San Diego, and I geek out on all this stuff, but not one class on wellness, on how to manage what's going on the inside. And so, Kevin, you know, who we are on the inside is as important as what we do on the outside. And if we come to our practices broken and fragmented and not well, I don't care how great of an implantologist you are, how well your preps are, the longevity and wellness of the culture of your organization and the care that we give to our patients will be limited. And my ambition in my second half of my career is to go from success, which is what I've accomplished, to significance. And I want to get back to my profession by showing that we're not very far from making positive pivots so that dentists can see a small change can go a long way. And that's what's in my research.
I love that. And I love that we are becoming more okay with saying, I need some help or I'm having problems right now. Is that something that a dentist should be able to share with his or her team and be comfortable doing that?
Well, I'll speak from personal experience. About 10 years ago, I went through a phase where I don't know if you want to call it a midlife crisis or a burnout crisis. But I'm a high achiever. Owning those practices, I used to wax my own cosmetic cases. I used to prep my own stone models before I prepped the patient. I would call on my patients at night. I saw my first patient at 7 a.m. We'd finish at 6. Eventually caught up to me. And I experienced a dark burnout myself. And through faith and my support of my wife and therapy, I was able to work through it. And out of that outcome, I was able to make a meaningful experience to it. And so I started having these conversations with dentists. And as I was a director of CCADS, California Center for Advanced Dentistry, we would talk about cosmetic and functional dentistry, but then it was the hallway conversations that really were powerful, Kevin. where they've talked about how they were feeling trapped. They were feeling like they were decaying on the inside. One dentist said that, my operatory is a 9 by 9 operatory, almost like a prison cell, and I don't have any windows. And I hear these stories, and the theme is I can't tell my team, because if I tell my team that I'm struggling, then A, are they going to respect me? I can't tell my patients, are they going to say yes to treatment? Because dentists are not supposed to be struggling. If I share that I'm struggling with substance use disorder, what about my DEA license? And so dentists often feel isolated and alone and fearful of sharing this very normal physiological and psychological response to chronic stress. Burnout is not a psychological disorder. It's not mental illness. It's not a character flaw. I want all of your listeners to hear this, that it's not a weakness. It's a normal response to unmanaged chronic stress, and how important it is that we collectively communicate and lean on one another so that we can share the burdens. Nobody understands a dentist like a dentist, and how important it is the professional organizations are in supporting one another.
And I love that there are support mechanisms in place or getting in place. And as you said, Dr. Kessler with the American Dental Association, I know this is such a focus for him. Do you see that this generation of dentists is helping the next generation of dentists, those maybe in dental school or just outside, to know that this is a stressful line of work and there are resources?
Kevin, I would say in my interaction and coaching with dentists and in my research, the dentists that are engaged, they're showing vigor, dedication, and absorption in their profession, are the ones that are giving back. But unfortunately, the far majority of dentists who are struggling aren't doing that. And I find I don't find the younger dentists struggling any more than the older dentists who are not engaged. And what I find is that they have different stressors. So I read a study recently that 3rd and 4th year dental students, 40% of them qualify and meet the criteria of burnout. 3rd and 4th dental students, 3rd and 4th year dental students, before they even graduate. And 35% of those dental students use cannabis on a regular basis to deal with anxiety and depression while in dental school. And then you graduate with, I went to USC, $600,000 in debt just in dental school and in the job market. And so they have different stressors versus a seasoned dentist who may not have the economic burden, but the shift has changed where what they used to do, Kevin, you can't do at 50 what I did at 30. And there are books that are written about half-life cycles of professions, that you reach a peak in your profession. And when you reach that peak, what do you do at that peak? You begin to physically change. Your eyes, your neck, your hands, they have a change. Your values change, but yet you still have the demands of running a practice. And so I see I see the challenges are different, but I see across the board this general theme that we don't do real well communicating how to manage chronic stress. Substance use disorder, 10% of all California's dentists report that they need to drink less. Suicide ideations, how do you report that? But about 10% of dentists report some sort of suicide ideation. Last summer, my neighbor, 2 blocks over, went to his office on a Saturday and took his life in his office. Now, was it because he was a dentist? All I know is I sure wish I was in his frame of his door frame that Saturday. And I would have said, listen, the studies show it doesn't take much intervention, Kevin, for it to actually make an impact. And part of that impact is having a community where you can purge. One of my participants says she emotionally purges before she gets to her home and she's able to get it out.
So is that the key? Being able to get it out, being able to purge?
There's 2 keys. There's the personal responsibility of the worker, whether it's the dentist, hygienist, any administrative staff. We have a personal responsibility to practice restorative renewal. And so we say, if you're not eating well, if you don't have your hobbies, if you're not taking your vacation time, if you're not developing friendships, we know this. We know that there are restorative practices, Kevin, that we can do that are very vital in wellness. But in my research, this is the shift. is that I don't care how many vacations you go on, Kevin, you'll lose your vacation buzz by 10 a.m. on Monday morning if you go back into a workplace that's toxic. And my research is showing that there are well-established stressors that cause burnout in a dental office. And understanding and becoming aware of these stressors and changing the workplace environment before the workplace environment changes us.
Mm.
So, yes, we often put the responsibility on the worker, but it's the workplace environment and the structure and the culture of that environment. And that's my research. And that's what I'm most motivated. Sometimes they're 3 feet away from gold. That's all. It's a positive pivot, but it makes a huge impact.
I feel like there was a time in dentistry, and I've been in this for 25 plus years, that when we mentioned culture, we mentioned leadership, people kind of rolled their eyes. And now I feel like that maybe there's a little bit of a shift there that people understand, not only to keep your team members together, that culture shift needs to happen, but also, as you said, to keep your focus, to keep your drive going, and to keep your attitude where it should be, that culture has to change as well.
And I tell you what, it sure is easier to go to a CE course on dental materials than it is going to a course where you have to work on yourself.
Mm-hmm.
And it takes a lot more courage to admit and become aware that one is struggling and needs some help and needs a community than it is to learn another widget and learn another and buy another machine. And I think that's where I really want to encourage your listeners is that personal responsibility will change. It's like the concentric circle. Once you start changing from within, and then you'll change the people right outside that concentric circle, and they will change people, and they will change people. But really does start with what's going on our inside.
Last question for
Yeah,
you, and I feel like we could talk for hours upon
I
this, so I
love it.
really appreciate your time. I know that there has been a shift also in organized dentistry where so many people now will get their CE online and do everything online instead of attending meetings or doing things where there is that community. Is that part of the problem with isolation as well?
Well, I'll give you an example. So I'm the chairman of the Wellness Committee for Orange County Dental Society, and it covers a big span. It takes me an hour and 20 minutes to get to the headquarters of Orange County. And so we're spread out. So we do our Wellness Committee online and Zoom. We miss something by not being in person. So logistically, remote brings us together, but we do lose that community. There is still very good impact by having us, like right now, you and I getting to know each other remotely. Like there's value in that, but there's nothing that takes the place of rubbing shoulders and over a drink, having a discussion and going, wait, Kevin, you deal with that? Like I'm not alone? Like, wait, there's nothing wrong with me? Wait, so there is, you've worked through that. And all of a sudden it normalizes it.
And I love that we've been able to talk about this today. And again, I'd love to have you back on to dive into some more things because I feel like as we get near the holidays, as we get near the start of the new year, it'd be a perfect time to dive more. But before I go, Dr. Johnson, I'd love for our readers to know how to get a hold of you with all this research and knowledge that you have.
So I have started an organization called Leaders in Dentistry. And what this is dentists connect with dentists, hygienists connect with hygienists. It's like a weekly dose of trying to put us a little bit of the right stuff every day in the right direction. And I want the readers and the listeners to hear that sometimes the darkest hour of the day is an hour before sunrise. And sometimes when you feel like you're doubting who you are, you're doubting the profession, you're doubting the decision you made. Sometimes we just have to hold on for another hour until the sun rises. And then we look back and we're like, man, I was feeling something about an hour ago, but I'm so glad I didn't act crazy when I was feeling crazy. And that's what communities do. And so Leaders in Dentistry, my email is smile@drericjohnson.com or info@leadersindentistry.com. I have a website. You can find me on Instagram. Reach out to me. And I would love to talk to you and give you some of the research, some of the empirical data supported ideas that have been proven to show us how you can make a positive pivot in your career.
So here's the good news for our reader. I should say our readers, viewers, listeners. If you're reading this on drbicuspid.com, All the information that Dr. Johnson just shared about contact information, it's all in the article, very easy for you to find, one click, as well as if you're listening to this, hey, it's in the show notes. So again, very easy for you to find and connect as well, because community, as we know, is so very important. So, Dr. Johnson, I really appreciate your time, and I'm already looking forward to our next conversation.
Pleasure to be here. Thank you.
Absolutely. And thanks to all of you who've listened to this episode of the drbicuspid.com podcast or watched it. And we know how important it is to admit when something isn't exactly right and to find those people who can help you through those times. And we're glad to connect with people like Dr. Johnson who are experts in that field. Until next time, it's Kevin Henry, editor in chief, signing off. And as always, wishing you nothing but success ahead.